Good afternoon. I'm Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force, and I'm joined by Johanu Botha, the operations lead of the Vaccine Implementation Task Force. As of today, we have given more than 146,000 doses of COVID-19 vaccine to eligible Manitobans. People age 65 and older and First Nations people age 45 and older are eligible. If you want to know when you or a loved one will be eligible, you can sign up to be notified at protectmb.ca and then book by phone or online. I've been fortunate to give some of the immunizations as part of the campaign, most recently to Dr. Rusin and Grand Chief Garrison Setti. And I have some tips to share with everyone for when they make their appointment. So we are asking people if you're able to review the consent form online and print it out and sign it in advance. This really helps things move quickly in the clinics and smoothly when you get to your appointment. Make sure you bring your health card if you have one or another piece of identification. Wear a short sleeve shirt and also wear your mask. And please help us to provide good physical distancing by only arriving 15 minutes before your appointment. I also want to note that in Manitoba, anyone who is currently living here is eligible for the vaccine. And by that, I truly do mean everyone. Je tiens également à préciser que tous les gens qui se trouvent actuellement au Manitoba sont en droit d'être vaccinés. Cela signifie que tout le monde est admissible au vaccin. So we are not basing this on immigration status or residency or whether or not you have a Manitoba health card. We know that there are many people in Manitoba who live elsewhere for part of the year. Perhaps you are an international student or a migrant worker or a person who is here providing care for others. If you've been here for at least a month or will be here for that amount of time, and you meet the eligibility requirements for the vaccine based on age or health condition, you can get the vaccine. It is available at no cost, regardless of whether or not you have a Manitoba health card. Vous pouvez être un étudiant étranger, un travailleur migrant ou quelqu'un qui est venu ici pour prendre soin d'autres personnes. Si vous êtes ici depuis un mois, au moins qu'un mois, et que vous remplissez les critères d'admissibilité à la vaccination qui sont déterminés en fonction de l'âge ou de l'état de santé, vous pouvez vous faire vacciner. Le vaccin vous sera offert gratuitement. Yo quiero repetir una tercera vez en español que todo el mundo que vive en Manitoba es elegible a recibir la vacuna. No importa si uno es un ciudadano, refugio, trabajador migrante, estudiante internacional, si usted ha estado o va a estar en Manitoba por un mes, por cualquier razón, usted es elegible. La vacuna es gratis. So this approach recognizes that all people who may be at higher risk of hospitalization or death should be protected first, because ultimately that approach best protects all of us. And while the vaccine supply is increasing, we still don't have enough vaccine for everyone who wants it. And so that's why we're focused on the science right now. The data is telling us that older Manitobans and those with specific health conditions are more at risk of severe outcomes and need to be protected first. As we get more vaccine, we'll be increasing the eligibility to other populations. But until that time, we're going to continue to focus on the science and ensure that we're protecting those most at risk. We have seen very good uptake of the vaccine in personal care homes, with the vast majority of residents receiving 2 doses of the vaccine. But that doesn't mean that we can relax. While the vaccine is very effective at stopping severe illness and death, some jurisdictions have reported transmission of the virus can still occur in people who have received 2 doses of the vaccine. And while the illness in people who are vaccinated appears to be significantly less severe, we still want to take steps to protect others as much as possible. That is why we are continuing with asymptomatic testing for staff at long-term care facilities. We strongly encourage staff to be tested regularly to help continue to reduce spread of the virus in that setting. This is why we also encourage people to continue to follow the fundamentals, even after they've been vaccinated. If you've received one or even both doses of the vaccine, we want you to keep following the fundamentals and the current public health orders. Wearing masks, practicing physical distancing, and good cough etiquette will remain important for some time to come. Si vous avez reçu une dose ou même les deux doses de vaccin, nous vous invitons à continuer d'observer les gestes de base et les ordres de santé publique en vigueur. Pendant un certain temps encore, il restera important de continuer de porter le masque, de se tenir à distance des autres et de respecter l'étiquette respiratoire. We especially need people to keep doing these things right now in order to protect those who have not gotten their vaccine yet. Right now, about 9% of Manitobans have received either 1 or 2 doses of the vaccine. But we need that number to be much higher before we can consider letting our guard down. One of the things that has been invaluable to our planning and ongoing monitoring and surveillance of immunization in Manitoba, and something that I want to talk about for a couple minutes today, is the Public Health Information Management System, or what we call FIMS. FIMS is what tracks every immunization that you or a loved one has received, like measles, mumps, and rubella vaccine, or the seasonal flu vaccine, and now we're using it for COVID-19. It's an integral part of our public health monitoring system, and it is an excellent data system. Manitoba is able to report on important data from FIMS, and in fact, our monitoring of immunization goes back to the early 1980s. It's accurate and it's updated as soon as it's been entered, so that at super sites, this means we're getting data right away, while at some other locations it might take a little longer for our data to be updated. But the key is that when I report to you or anyone from the task force reports on the numbers of doses administered, we know that every single dose that we're reporting is a number that was an actual needle in an arm. We know that that number is always the minimum number of doses that have been immunized, and in truth, there probably are always higher numbers that have gone into arms than what we see because of the slight delay we get outside of our supercenters. In my experience, FIMS is the best of its kind in the country, potentially in the world. I don't think that there's any other province that is able to report public health data on vaccine delivery with any better accuracy than Manitoba can. Other jurisdictions often have to rely on estimates. They rely on inventory to be a surrogate marker instead of actual vaccines administered, or sometimes they'll use extrapolations based on partial data from parts of their regions. But in Manitoba, we know that our data represents all needles that go into arms. And this helps us to know what we've accomplished and what we have yet to do. And it goes a long way to ensuring we're able to provide timely, accurate information to Manitobans. With that, I will now turn over to Johanu.
Thank you so much, Dr. Reimer. Good afternoon, everyone. My name is Johanu Botha. I oversee the operations and logistics and planning side of the Vaccine Implementation Task Force. As we have said many times, this will be the largest immunization campaign in Manitoba's history. My background is in emergency management, so for me, the closest comparison would be coming together to fight a wildfire or a large flood. But the pandemic affects the whole province and everyone living here almost at the same time. So this is truly a shared effort that we're all tackling at the same time. The scope of this challenge is not lost on any of us, and it really is an honor to be involved in this work. We are focusing on getting the vaccine to as many people as we can, as quickly and as safely as we can. To achieve this, we set ourselves a target: building a system that could deliver enough doses of vaccine every day to immunize eligible Manitobans by the end of the summer at the latest, as long as supplies arrive. That target is our daily maximum capacity. We said we wanted to be able to deliver 20,000 doses a day by April 1st. With the launch of the Morden Super Site this week and growing capacity in our pop-up clinics across the province, we have met and exceeded this goal, more than a week ahead of schedule. That means that our framework, the way that we can deliver vaccines to people, is largely in place now. And while vaccine supplies have been slowly increasing and is expected to continue to grow in the weeks ahead, we still don't have enough vaccine to truly operate at that level of 20,000 doses a day, to stress test our system, so to speak. We continue to be limited by supply. But every week, we're delivering more vaccine at super sites in each of our regional health authorities and at pop-up clinics in more rural and remote communities, all while also ensuring we reach the most vulnerable people through focused immunization teams and partnering with First Nation leaders and medical experts to support their work. Our plan focuses on how we immunize the most people, most effectively, yes, but also reaching them where they are when possible and as safely as possible. For our province, that means there isn't a single solution and we have to strike the right balance. Super sites would be fastest, but that doesn't recognize our unique geography or our population. It doesn't work for all vulnerable people, and by themselves, super sites wouldn't help make the vaccine more accessible to more people. For example, we are bringing vaccine to more smaller locations throughout the province through more pop-ups for people who may not be able to get to a super site. These are coming up, for example, in Victoria Beach, Portage la Prairie, Arborg, Lundar, Russell, Riverton, Lac du Bonny, Killarney, Morris, and Stonewall, with more to come. More pop-ups are being planned, and we will continue to announce those as they become available. I'd encourage people to book their appointment at a super site or a pop-up when they're eligible. It's so exciting to see that people are signing up for a vaccine. But I know there has been a bit of a frustration for people as well. In the short term, we are trying to find the right balance of appointments at our immunization locations. We're only booking vaccine appointments a few weeks into the future, and we have to allocate vaccine based on the population by region across the province, the supply that we're getting, and of course the eligibility criteria set up by Dr. Reimer and her team. What this means is we may not always have appointments available at all sites at all times. We're not at a place yet where we can offer vaccine on demand like that. But we are doing everything we can to be flexible and are opening up more appointments as quickly as possible. To support the vaccine campaign, we're also actively recruiting navigators across the province, primarily for each super site. And navigators are non-clinical roles, and they help clients find their way to their appointments at a super site. They support them throughout the entire immunization process, including check-ins, and they've been a critical part of our success, and we need more. If this sounds like something that is interesting to you, you can apply through the Shared Health Jobs website, and there is also a link from the province's vaccine site as well. To wrap up, I just want to thank the thousands of people all across the province who are the reason I can share and report on our progress. The immunization campaign wouldn't be possible without regional health authorities, our First Nation partners, municipal governments, staff and volunteers from every part of Manitoba, and of course every eligible Manitoban who books an appointment to get a dose. We spend a tremendous amount of time at the task force crunching various numbers. Analytics is important to us as it makes for good planning and it provides the public with benchmarks, so we're kept accountable for our performance. But I think it's important to note that ultimately the number that counts is the 100% of Manitobans that we are doing this work for. It's about getting Manitobans protected. You're rolling up our sleeves and doing the work so that we can all very soon roll up our sleeves and be immunized. The importance of that just can't be overstated. Thank you so much, and I'll pass it over to questions.
Thank you. A reminder to our reporters on the line, you'll have one preliminary and one follow-up question. Up first this afternoon from CJOB, Skylar.
Hi, doctors. Thanks for your time this afternoon. We heard from some listeners that the Winnipeg Supersite experienced some delays yesterday and again this morning, and you mentioned in the technical briefing that may have been due to an issue with the FIM system. Can you go into a little more detail about what's happening there?
So the issue wasn't with the FIM system, as I understand. It had to do with our booking system, that the platform. There was some technical difficulties with that. It was resolved fairly quickly, and we're reviewing our business continuity plans for that kind of IT scenario. In terms of this morning, I'm not aware of what the specific issue is yet. As you know, we are in the midst of starting a pilot in how we reconfigure the space at RBC. So we're in a pilot mode to some degree, and so there might be some bumps along the way that may have nothing to do with the booking system. The long-term goal of this pilot is that we'll be able to get Manitobans through those sites at greater numbers while providing a better client experience. But while we're launching that new model on the floor, that may be causing some of these bumps, and we're expecting that. So we'll take those lessons learned and keep refining as we go.
Thanks for that. Changing gears, I guess, for a little bit for my second question. There are studies that say someone who's recovered from COVID-19 already has those antibodies, and getting the first dose of the vaccine just acts as a booster to that. Quebec says it's only going to be giving one dose to those who've already recovered from the virus. Is the province giving any consideration to doing that here as well, and that would help stretch supply?
Yeah, that's a great question. So we do have some early data showing that the immunity that someone gets from the infection really can be boosted by one dose. But the data right now is still early and not, there's not very much of it yet. So what I would say is that in Manitoba, we would absolutely consider whether or not to offer the second dose to people who've had the infection. But right now, based on the information we have in front of us, our plan is to continue going forward regardless of whether or not someone's had infection in offering the first and the second dose along with other Manitobans. That said, it is our recommendation that anyone who has experienced a COVID-19 infection should wait 3 months before receiving their first dose of the vaccine, because they very, very likely are protected from the virus during those 3 months from the time of their infection onward. And so we're encouraging people to wait a bit longer to allow Manitobans who don't have any immunity to get access to their first dose earlier. But going forward, as the data expands and more studies come out, this is absolutely something that we would look at in Manitoba to help us determine how best to make use of the doses that we have.
From the Winnipeg Sun, James.
Good afternoon, Dr. Reimer. Is there a conversation happening right now at the province about Manitoba sourcing its own vaccines?
I actually think I might hand that question over to you, Johanu.
Thanks, Dr. Reimer. James, in terms of sourcing its own vaccine, I know that our government has looked at domestic supply, obviously, and it's concerned with the longevity and sustainability of a domestic supply, so that we can have resiliency here for this pandemic and the next one. So I know that's certainly been looked at. But in terms of the vaccine that's coming in, everything that the task force knows of is coming from the federal or via the federal government.
Thank you.
From CBC Radio Canada, Zoe.
Bon après-midi. Good afternoon. How long exactly in terms of hours was the booking for appointments suspended in Thompson, Selkirk, and Brandon?
Sure, I can take that one. I don't have I haven't collected the full amount of hours. It was a couple days in Brandon and Selkirk, and what we're seeing is that every day we're able to open a new batch of appointments, and then they're swallowed up pretty fast for now. So I don't have the hours specifically, but what I can say is I anticipate that by the end of this week, at the latest early next week, we will be in a groove again, so to speak, where as we release cohorts, so that's the planning phrase for as we go down the age eligibility, there should be appointments available almost always at every single super site. It's not perfect, but we're pretty confident that it'd be rare that we won't have appointments available.
Thank you. And when will people under 65 years old be able to get vaccinated, considering that a shipment of Pfizer BioNTech is expected to arrive tomorrow or Friday?
So I can speak to the supply side of it. We continuously monitor the uptake on our appointments. And that's the fine balance we have to strike. And if we feel like that cohort within the most recently released age group has sort of had their chance at appointments, and more and more appointments are opening up and not being used, our planning team gets together with our appointment team. Dr. Reimer obviously is there from an eligibility perspective, and then we decide to go an age down. The puzzle that we're always trying to solve on the planning side is we would like to go down that age eligibility as fast as feasible. We want to get doses in arms. That's our goal. We want to inject what we get. But at the same time, we want to avoid a scenario as much as possible where we have individuals who are eligible, but they can't make an appointment. Now, we have managed that balance pretty well up to this point. I think almost for the most part we've managed that. We're in a bit of a pressure point this week by dropping to 65. So in some locations, not across the province, those appointments are filling up. So we're watching that. We're staying at 65. When we think that we'll have enough appointments open up again, where a next age cohort will be able to use those appointments without filling them up again where no one can make appointments, that's when we'll drop it. So it's really a monitoring thing. We don't want to put a line in the sand in the future. We have to see what Manitobans do and how they book.
From CBC Manitoba, Ian.
Good afternoon. Dr. Reimer, as you're aware, I guess it was last week when the National Advisory Committee on Immunization recommended that access to the AstraZeneca vaccine be available to those 65 and plus. You said Manitoba was considering that, I guess. It's been a week later now. Why is Manitoba not doing that at this point?
Yeah, that's a great question, Ian. Thanks. So we were very happy to see that the National Advisory Committee on Immunization broadened their recommendations to include older Canadians for eligibility for AstraZeneca. The issue that we're facing in Manitoba is that despite the increase in eligibility, we have not received any increase in doses. So we received 18,000 doses prior to NACI changing their recommendation. But since they've changed their recommendation, no further doses have come, and we have not been told yet from the federal government when nor how many doses we can expect for AstraZeneca going into the future. So it's difficult for us to release our plan on who we're going to be offering the AstraZeneca doses to because we don't know how much or when it will be coming. And what our intention is, as soon as we get information, any sort of confirmation from the federal government about doses, that we will then look at where we are in the eligibility provincially, what we use for the mRNA vaccines, and we'll try to adapt the AstraZeneca eligibility to complement that. But when we don't yet know how much or when we're getting it, not only do we not know exactly how to complement the rest of the eligibility criteria, but we also don't know how large of a pool we can try to address with those potential doses. So, I would say certainly we're looking at a few different options as far as what we're going to do with those doses, but depending on how many and when, would change whether we go younger, whether we go older, whether we focus still on health conditions, or look at people who are homebound. There's a lot of things that we will be considering, but they all are very dependent on that confirmation from the federal government.
Okay, thank you for that. And finally, I guess, how is Manitoba going to reach through to those seniors who haven't gotten the shot yet? What's preventing them from getting the shot, even though they're those at highest risk?
I think there's a lot of things that may, I don't know if prevent, but slow down people signing up for a vaccine. So certainly for some seniors, navigating the website or the call center can be very difficult. For other folks, they may have competing priorities, other things that are going on in life, and it might be hard to get this to the top of the to-do list. There may be those folks who aren't aware that they're eligible. And then there's those who have questions and need some time to review the information with their loved ones or with their healthcare provider. So because there's so many different reasons that people may not sign up right away, we need to make sure that we have many different approaches to try to address all of those different reasons. And so we're working on a variety of mechanisms. We've met with a large number of seniors organizations to ensure that they have the information at their fingertips to share with their members and their clients. We want to work with community leaders to share information. We have created toolkits for healthcare providers to be able to help inform the discussions that they have with not just seniors, but all of their patients. And we are starting to work on the Protect MB campaign as well, which is starting with website and social media, but we plan to expand that to have reach far beyond social media and website, and you'll start to see that rollout happening in the near future as we try to get information to as many people as possible.
From CTV Winnipeg, Michelle.
Hi, I'm wondering, we heard from a health advisor for the national, Health Canada, saying that delaying the second dose for seniors might not affect efficacy the same way that we first think of it. If you could tell me if you're looking at this or if you're waiting for advice from NACI.
So when we first started the campaign, one of the reasons that we did the second dose initially was because of that very concern. We do know that as people age, their immune response can weaken, either become less overall or be slower to reach that peak. And so until we had data to rely on, we decided in Manitoba to ensure that for our personal care home residents, top of mind, that we had that second dose available until we had some evidence showing us that the first dose would be sufficient. The data that came from specifically BC, Manitoba, and Quebec was heavily weighted towards long-term care residents because that's who was receiving vaccine. So in all three of those data sets, we saw that very effective response in the 70s or 80s as far as vaccine effectiveness occurred both in the healthcare workers as well as the residents of long-term care facilities. And that's really where we had been worried. And so it was very reassuring to see that in those settings that elderly Canadians did experience good protection from one dose of the vaccine. But all along, we've said we need to keep watching this because we know that the whole world is learning together at the same time. And if there are growing studies and if there's growing evidence showing that there are groups that we should be concerned about, we can always pivot again and start to offer the second dose to folks who we start to see may not be protected enough from dose one. So we will work with NACI. And we'll work with our medical advisory committee, our epidemiologists, our medical officers of health, to make sure that we are keeping on top of all of the studies as they come out. And we are open to shifting towards whatever the best science is at the time.
Thank you. Also, I'm wondering, we're hearing about these possible export restrictions from the EU that may or may not affect shipments to Canada. I know this is a federal thing, acquiring vaccines, but what sort of planning is in place or what could potentially happen if we do have another significant slowdown?
I can take the first, don't mind the pun, jab at it. First off, it is a question for the federal government on what sort of contingency planning they're building in to their procurement process. I think as Dr. Reimer has mentioned so often, vaccine supply is inherently volatile, even outside of COVID. So it is just the nature of that market to some degree. What I can say about what we can do as a province is we monitor, obviously, and we're heartened at the moment by the fact that our AstraZeneca Covishield doesn't come out of the EU factories, and that there is good news, it seems, in terms of AstraZeneca coming from the United States. But ultimately, we rely on confirmed delivery schedules from the federal government, and that's what we use to base our planning on. Luckily, we have a system in place with many channels that can administer many types of vaccine. So as we watch, urgently, excitedly for AstraZeneca Covishield, we have other channels in place to continue to administer the Pfizer and the Moderna.
From City News, Jonas.
Good afternoon, folks. Mr. Botha, maybe I'll start with you as we are talking about vaccine supply and AstraZeneca concerns. But we did hear this morning that we are going to see a rather large jump starting here next week, I believe.
Is the question there, Jonas, or just general thoughts on supply?
Sorry, I guess at the end there, I thought that was my question. We did hear this morning, correct, that we are going to see a jump next week? Maybe just a message on what we are seeing of Pfizer, Moderna here in the next little while?
I gotcha. Absolutely, yes. So while we don't have anything confirmed on AstraZeneca Covishield, and we're watching for that, you're absolutely right. There's hope in the window in terms of the supply stabilizing and actually becoming quite robust for both Moderna and for Pfizer. So later this week, we're hoping for about 40,000 Pfizer doses to come in. Those, by and large, are allocated right away to our super sites. And because super sites are so effective and efficient, they can start working down those doses pretty quickly. And we expect and hope for around 40,000 every single week from Pfizer until about mid-end May. And the same thing will happen with those. Is currently the plan is they come in, we right away get them to super sites based on population, and we start working down those doses. So that is what will happen this week when we get that 40,000 of Pfizer. You're also right that between now and the end of March, we will be getting 40,000 Moderna as well, likely around 12,000 this week, and then likely around 28,000, 29th, 30th of March. That Moderna will be going to our First Nation partners, of course, to support them as they really launch into their prioritization index campaign. It'll support all the pop-ups we've been talking about. The Moderna is slightly easier to transport for a variety of reasons compared to Pfizer, so they're primarily what we use for our pop-ups and for our focused immunization teams as we continue to deploy those teams into congruent living facilities. And we also have Moderna then confirmed in April as well. So we'll get about 70,000 doses of Moderna. That'll be allocated to the same types, our First Nation partners, pop-up campaigns, focused immunization teams. So it is good news. There's a robust and steady supply of Moderna and Pfizer coming in starting this week, and that is why, not to belabor the point too much, but why we'll start to see starting Friday, really, every single day's amount of doses administered should be the lowest around 3,000, early 3,000s, but at many times over, as we get into April, will be over the 10,000s. depending on supply and how we're able to allocate that through. So we're going to see a decided spike in how many doses we administer each day, essentially starting this Friday.
Thank you very much, sir, for that. And just one that we also heard this morning on, there's concern about doses and freezers and where they're going. And there had been some concern the last little while that maybe it wasn't being rolled out. But I think a lot of this was pre-allocated for the First Nation rollout, the massive campaign that's going to start up north. Am I correct on that? Maybe just an explanation on how these doses are decided on.
Sure, thanks. So I love this question because I love talking about the day in the life of a dose or a week in the life of a dose and sort of communicating how they're always moving. So in a nutshell, you can put doses in sort of 3 buckets or 3 categories. The first bucket is a dose that's been administered, which obviously is our favorite dose because that's one that's in an arm. It's protecting a Manitoban. The other type of dose is one that's been allocated, as you say, to one of our partners, a First Nation partner or a clinic or a pharmacist. That's out of our hands, so to speak. It's up to our partners to administer it as they see fit. Ultimately, down the line, once that dose is administered, it will show up in our system as administered into the FIM system that Dr. Reimer was talking about, but there might be a bit of a lag. But that's off to our partners. And then we have the other type of dose, which is the dose that we call a booked dose, which is the one in the system. This is the one that the Vaccination Implementation Task Force is directly responsible for administering. At the moment, there is just under 25,000 of those in the system between pop-ups, focus immunization teams, and super sites. And if we don't get any more supply by the end of this week, this will be done by the end of this week. So we will have no more doses to administer. I hope that answers the question.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Reimer, my first question is for you. How exactly is Manitoba monitoring the effectiveness of the single dose over the 4-month delay period? Is there a cohort of vaccinated Manitobans who have signed up to be part of a study in Manitoba, or how are you monitoring this?
Well, one of the strengths of the way that Manitoba monitors both COVID infection and immunization is that we actually use the same program, the Public Health Information Management System, for those. So we can see for any individual both whether or not they've had an infection, as well as when and how many doses of COVID-19 vaccine they've received. So we are able to, in real time, look at each individual who does experience an infection to determine whether or not they were vaccinated prior to that infection. If they were, how long prior to the infection did the vaccine occur, and how many doses. Now, the how long is particularly important because it does take about 2 weeks for the body to mount an immune response or to build up that army that will recognize the virus and be able to fight it off in the future. So if someone were, for example, to get an infection 2 days after they're immunized, they probably were infected before that vaccine went into their arm. If they get an infection 6 or 7 days after receiving a vaccine, it's possible they were infected after the vaccine, but it still would be before their body had a chance to build up that response system. So we are monitoring all the time for every single case that gets diagnosed in Manitoba to determine whether or not it happened in someone who was immunized or not immunized. And that allows us to compare to the general population who has not received a vaccine, comparing it to those who have, to determine how protective that vaccine truly is. And what we're seeing so far is, particularly in personal care homes, is a massive drop in the number of cases that occur after vaccines have had a chance to lead to that immune response. So broadly speaking, it's been very encouraging. Where we're seeing a little bit of concern after one dose is in some of our First Nations communities, where we know due to the same reasons that they were at higher risk in the first place, whether that's poverty or housing or just a lot of the effects of colonization, it's possible there that that first dose is not as effective because there's so much more exposure to the virus in those congested settings, that first dose may not be as protective as we had hoped. But we're still early on even with the data on that, and are working with the First Nations partners. And if they tell us that we need to shift an approach in those populations, we can do that.
Thank you. It's quite interesting. So I'm wondering, as a follow-up, how much of this data would you need before you can make a decision about whether the delay between doses is a good thing, or if you're seeing significant problems or concerns? What kind of volume of data do you need? And I guess, are you going to pull from other jurisdictions as well to make a decision?
Yeah, so we would absolutely use information both from Manitoba as well as from other jurisdictions. Canada has largely done this all at the same time, and so we can certainly be learning from each other as we move forward. In Manitoba, I would say that it's not just the volume, but also the extent of the difference. So if we saw a large drop in effectiveness, even if it was not a very large group of people, that would cause us to move faster. Whereas if it was a small difference, we would want more data before we shifted our whole strategy. And what we're seeing so far, apart from the possible caveat of some First Nations communities, is that the protection has shown to be quite effective in most of Manitoba. So at this point, with regardless of the volume that we have, it's reassuring data and doesn't lead us to want to reassess this strategy for the general population. When it comes to the First Nations table, I would say that our First Nations health experts are really leading the discussion on that, and we'll be working with them and following their guidance on how best to serve those communities if they feel that the vaccine effectiveness after one dose is not sufficient.
From Global News, Malika.
Hi, Dr. Reimer. I believe this question might be for you. We wanted to see what the kind of timeline could be at this point for those that have already received their first shot. Are we looking at the long range of 4 months still, or are we looking at a shorter time frame for their second shot? Is this still all subject to change for vaccine availability? Any sort of idea at this point?
Yeah, I can take a first stab at that. I mean, right now, our plan would be when we have exhausted the Manitobans who are over 18 and want a dose, that we would start with our second dose at that time. So based on the estimates that I know Johanu and his team have provided, in our sort of best case scenario, we're talking late May. Possibly it could be later in June, but that's very dependent on the supply that comes in. Certainly, unless we were to see something in the data that showed us that a longer delay was actually more beneficial for the level of protection. So unless we saw that, we really would move to dose 2 as soon as we've gone through the majority of adult Manitobans with dose 1, and we wouldn't wait until the 4-month mark if we have the doses to be able to start on dose 2.
Okay, thank you. And in the release, it says the focused immunization teams will visit more than 100 congregate living spaces, provide first doses to eligible and consenting residents. Do we have any examples of some of these congregate living spaces? Are they more care homes? Are they, are they any, is there any examples that you can give us?
I don't have the list in front of me, but I believe that we do release the schedule on a week-by-week basis of the sites that we're going to, so we can take that away and get you the most recent listing of sites that we will be going to.
Our final reporter this afternoon from the Brandon Sun, Michelle.
Good afternoon. I'm wondering if you can be a bit more specific on when we can expect announcements on future pop-up clinics in the Southwestern Manitoba region.
So our goal is certainly to run another pop-up campaign and to announce as soon as we have a pop-up locked in to pop up. But this is a collaborative process with the Regional Health Authority. So there are partners in this. They're the ones who run the pop-up, and I think as we keep stressing, the last thing that we want to do is ever cancel an appointment or cancel a pop-up. So we want to make sure that we have everything in place. And then the moment we have that, we will announce it. What I can confirm is we've heard Manitobans. We're very aware that it is not reasonable it's not reasonable to expect, especially in these age cohorts, for all Manitobans to be making their way to a super site. So the pop-up campaigns will remain a critical tool in our toolkit, including in the Prairie Mountain Regional Health Authority, and there will be information on there on those sites soon.
Okay, thank you. And I really apologize if this is a repeat question. I've been out of the vaccine loop for a couple of weeks. I'm wondering, in the best of all worlds, with a hope for regular flow of vaccine coming into the province, any ballpark when home visits might be available for those who need them?
So I'm going to pass to Dr. Reimer real quick because it depends on the vaccine type. I would just say that our ranges on the scenarios that we provide looks at all eligible Manitobans, and we've got that mid-May and the end of June, and those haven't changed. So those ones don't include whether or not we go to homes or not. But when we do it, while it's certainly on the radar and we will want to do it, it depends on the type of vaccine, and I think I'll pivot right over to Dr. Reimer on what kind of vaccine would allow that.
Sure. So what we know right now is that Moderna and Pfizer are very sensitive vaccines and they don't travel very well. Whereas AstraZeneca, on the other hand, it functions much more similarly to vaccines that we're used to, and so it can be moved around a lot more easily. But we only have 18,000 doses of AstraZeneca compared to the hundreds of thousands of doses we've had of Pfizer or Moderna. So I would say two things. One, for Moderna and Pfizer, we're working with the manufacturers to try to get better stability data. The RNA that's in them sits in what we call a lipid nanoparticle, or a very, very tiny little piece of fat. And that nanoparticle is very sensitive. And if the vial gets shaken or disrupted, you can actually ruin that nanoparticle, and the RNA can then degrade or be damaged. And the last thing that we want to do is to take a vaccine to somebody's home, not realizing that we damaged it along the way. So if we can get better stability data from the manufacturers that tells us that it's a safe and effective way to bring vaccines out, we will absolutely move to start using Pfizer or Moderna to get vaccines to people where they don't have other options. In the meantime, until we do feel confident that we're not bringing somebody a damaged product, we are considering using our next shipment of AstraZeneca in part to bring to folks who can't leave their homes, either in partnership with pharmacies or physicians. We're also considering whether or not this is something that home care could be offering. But all of those are, again, dependent on when we get AstraZeneca and how much. If we get a very small shipment, that again limits our ability to really use it in flexible ways. But if we end up with a larger quantity, then we can be much more flexible about getting that out to Manitobans who don't have better options.
Thanks, everyone. This concludes our media briefing.